Let's begin with 3 deep, centering breaths. Inhale slowly through your nose, feeling peace fill your body, and exhale gently through your mouth. Again, breathe in calm awareness and breathe out any tension. One more time, breathing in this present moment and breathing out distractions. Beautiful. Today we're exploring the microbiome of your skin, a fascinating ecosystem that plays a crucial role in your skin's health, appearance, and resilience. Your skin is home to trillions of microorganisms, including bacteria, fungi, viruses, and mites that live on and in your skin's surface. This complex community is called your skin microbiome. And far from being harmful invaders, these microscopic residents are essential partners in keeping your skin healthy. Just like the beneficial bacteria in your gut support digestion and immunity, your skin's microbiome protects against harmful pathogens, maintains your skin's pH balance, supports your immune system, and even influences how your skin looks and feels. Understanding your skin microbiome is becoming increasingly important in skincare. Research over the past decade has revealed that many skin conditions, from acne to eczema to premature aging, are linked to disruptions in the skin's microbial balance. When your microbiome is balanced and diverse, your skin is better equipped to heal, defend itself, and maintain its healthy appearance. When this balance is disrupted, a condition called dysbiosis, your skin becomes more vulnerable to problems. Learning how to support your skin's microbiome can transform your approach to skincare. Let's understand what the skin microbiome actually is. Your skin is not a sterile surface, but a thriving ecosystem where billions of microorganisms coexist. Different areas of your body host different microbial communities. Your oily T-zone has different residents than your dry cheeks, which differ from what lives on your arms or feet. Moist areas like your armpits harbor different species than dry areas. Even your left and right hands have slightly different microbial profiles. This diversity is normal and beneficial. The majority of your skin's microbiome consists of bacteria, with over 1,000 different species identified so far. Some of the most common and beneficial bacteria include Staphylococcus epidermidis, which produces antimicrobial peptides that fight harmful bacteria, Cutibacterium acnes, formerly known as Propionibacterium acnes, which helps maintain skin's slightly acidic pH, and various Corynebacterium species, which break down lipids and help maintain the skin barrier. Not all these bacteria are beneficial, but in balanced amounts, they coexist peacefully and even helpfully. Your skin microbiome performs many important functions. It acts as a physical barrier, with beneficial bacteria occupying space and resources that might otherwise be taken by harmful pathogens. Think of it as a city where all the apartments are occupied by friendly neighbors, leaving no room for troublemakers to move in. This competitive exclusion is one of your first lines of defense against skin infections. Beneficial bacteria produce antimicrobial substances that actively fight harmful microorganisms. Some species produce their own antibiotics, organic acids, and other compounds that kill or inhibit pathogens. Your skin microbiome is constantly protecting you, fighting microscopic battles you're never aware of. When this defense system is weakened through disruption of your microbiome, your skin becomes more vulnerable to infections and inflammation. Your microbiome helps maintain your skin's acid mantle, the slightly acidic pH of around 4.5 to 5.5 on healthy skin. Beneficial bacteria produce acids as byproducts of their metabolism, contributing to this acidic environment. This acidity is uncomfortable for many harmful bacteria, which prefer neutral or alkaline conditions. When your skin's pH is disrupted, becoming too alkaline, beneficial bacteria struggle, while harmful ones thrive. The microbiome supports your skin's immune function by training your immune system to distinguish between harmless or beneficial microorganisms and dangerous ones. This education happens constantly, helping your immune system respond appropriately to real threats while tolerating friendly residents. When your microbiome is disrupted, this training is compromised, potentially leading to inappropriate immune responses like inflammation and sensitivity. Your microbiome influences skin aging. Some research suggests that a healthy, diverse microbiome may help protect against environmental damage and oxidative stress that contribute to aging. Beneficial bacteria can produce antioxidants and other protective compounds. Conversely, an imbalanced microbiome may promote inflammation that accelerates aging. While more research is needed, supporting your microbiome appears to be an important aspect of maintaining youthful skin. So what disrupts this delicate ecosystem? Harsh cleansing is one of the biggest threats to your skin microbiome. Cleansers with high pH, strong surfactants like sodium lauryl sulfate, and antibacterial soaps strip away beneficial bacteria along with dirt and oil. Over-cleansing, washing your face multiple times daily or scrubbing vigorously, removes the protective layer of oils and bacteria that keep your skin healthy. The squeaky clean feeling actually indicates you've stripped your skin too much. Overuse of antibacterial products is particularly harmful to your microbiome. While killing harmful bacteria sounds good in theory, these products are indiscriminate, wiping out beneficial bacteria too. Unless you're in a hospital setting or dealing with a specific infection, regular antibacterial products are unnecessary and potentially harmful for everyday use. Your skin needs its microbial residents, and constantly destroying them creates more problems than it solves. Excessive exfoliation disrupts the microbiome by physically removing bacteria along with dead skin cells. While some exfoliation is beneficial, overdoing it with daily scrubs or strong chemical exfoliants stresses your skin's microbial ecosystem. Your microbiome needs stability to thrive, and constant disruption prevents beneficial bacteria from establishing stable populations. Environmental factors affect your microbiome too. Pollution particles and toxins in the air can harm beneficial bacteria while promoting harmful ones. UV radiation from sun exposure damages not just your skin cells, but also microbial populations. Air conditioning and heating create dry environments that stress your microbiome. Even the water you use to wash affects your skin's bacteria, with hard water or chlorinated water potentially disrupting microbial balance. Antibiotics, whether taken orally or applied topically, affect your skin microbiome. While sometimes necessary for treating infections, antibiotics kill both harmful and beneficial bacteria. Your microbiome typically rebounds after antibiotic use, but repeated or prolonged use can cause lasting changes. If you need antibiotics, using them as prescribed is important, but being aware of their impact on your microbiome helps you take steps to support recovery. Diet and stress influence your skin microbiome indirectly through your overall health and immune function. A diet high in sugar and processed foods may promote inflammation that affects your skin's microbial balance. Chronic stress alters your immune system and hormone levels, which can shift microbial populations. Supporting your microbiome involves caring for your overall health, not just what you.
The luteal phase, days 15 to 28, involves rising progesterone and maintained estrogen. This phase often brings worsening acne in hormone-sensitive women due to progesterone effects and androgen to estrogen ratio changes. Tracking your acne patterns against your menstrual cycle for 2 to 3 months reveals your personal pattern. Many women find breakouts clustered in the luteal phase, particularly the 5 to 7 days before menstruation. However, individual patterns vary significantly. Some women have no cyclical acne pattern, while others have severe luteal phase breakouts. Once you identify your cyclical pattern, strategic treatment timing can optimize results. If you break out mainly in the luteal phase, intensifying acne treatment frequency during this phase can prevent significant breakouts. For example, if you normally use salicylic acid 2 to 3 times weekly, you might increase to daily use during your high-risk luteal phase. This temporary intensification often prevents the severe breakouts that would otherwise occur. Planning professional treatments around your cycle optimizes results. Having a chemical peel or professional facial during your clear follicular phase when your skin is less inflamed and more resilient provides better results than during your breakout-prone luteal phase. Hormonal contraceptives can help by suppressing ovulation and stabilizing hormone levels. Many women find that switching to birth control pills with continuous hormone dosing, tricyclic or extended cycle pills that reduce or eliminate placebo weeks, significantly reduces cyclical acne by preventing the hormonal fluctuations driving breakouts. Spironolactone, anti-androgen, helps some women with cyclical acne by blocking androgen effects. However, effects are more modest for pure cyclical acne than for chronic hormonal acne. Dietary modifications might help cyclical acne through hormone metabolism. Some evidence suggests that supporting liver health through adequate nutrients supports estrogen metabolism. Consuming adequate B vitamins, magnesium, and fiber supports hormone metabolism. PMS supplements containing ingredients like calcium, magnesium, and vitamin B6 might help with luteal phase acne through their effects on hormone metabolism and inflammation. Some women find these supplements modestly helpful. Stress during the luteal phase exacerbates acne in many women. The luteal phase naturally involves slightly increased anxiety and mood sensitivity. Implementing additional stress management during this phase, extra exercise, meditation, or relaxation practices, can reduce acne by controlling stress hormonal interactions. Sleep quality often decreases in the luteal phase due to progesterone effects. Prioritizing sleep during this phase through good sleep hygiene, potentially with earlier bedtimes, supports skin health. Understanding your cyclical acne pattern allows realistic expectations and strategic planning. Rather than being frustrated by predictable breakouts, you can anticipate them and proactively manage them. This empowerment often improves both skin outcomes and psychological well-being around acne. Guide 52, Acne Cosmetica, Product-Induced Acne and Ingredient Avoidance. Acne cosmetica specifically refers to acne triggered or worsened by cosmetic products. Understanding this condition and identifying problematic ingredients prevents wasted time and money on ineffective acne treatments when the actual problem is product-induced acne. Acne cosmetica differs from typical acne in that stopping the offending product often resolves it completely, whereas typical acne persists despite good skin care. This distinction is diagnostically important. If your acne improves dramatically after discontinuing a specific product, acne cosmetica was likely the cause. Common culprits in acne cosmetica include foundations, particularly heavy, silicone-based ones, primers, concealer, powders, sunscreen, and heavy moisturizers. These products can clog pores through their occlusive nature or irritating ingredients. Specific ingredients commonly triggering acne cosmetica include dimethicone, silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61: Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62. Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59. Acne prevention in acne-prone individuals. True primary prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur.
Script number 79. Understanding hormonal changes in your skin. Soft calming tone throughout. Approximately 1,700 words. Hello and welcome to this peaceful moment together. Take a deep breath in and gently let it out. Today we're going to explore something that affects nearly everyone at some point in their lives. Hormonal changes and how they influence your skin. Hormones are powerful chemical messengers in your body. They regulate countless processes, from your sleep cycle to your mood, from your energy levels to, yes, your skin. When your hormones fluctuate, your skin often responds. Understanding this connection can help you approach your skin with more patience, more compassion, and more realistic expectations. Let's begin by acknowledging something important. Hormonal fluctuations are completely natural. They're part of being human. Whether you're experiencing monthly cycles, pregnancy, postpartum changes, perimenopause, menopause, or simply the natural shifts that occur throughout your life, these hormonal changes are normal and expected. Your skin responding to these changes is also normal and expected. You haven't done anything wrong when your skin changes with your hormones. You're not failing at skincare. Your body is simply communicating, and your skin is part of that conversation. So let's talk about how hormones influence your skin, starting with the most common hormonal fluctuation many people experience, the monthly menstrual cycle. During your menstrual cycle, different hormones rise and fall in predictable patterns. In the week or two after your period ends, estrogen levels gradually rise. This is often when your skin looks its best, clearer, brighter, more even. Estrogen promotes collagen production, helps maintain skin thickness, and supports skin barrier function. You might notice your skin feels plumper, more hydrated, and generally more radiant during this phase. Around mid-cycle, during ovulation, estrogen peaks. This is typically your skin's golden week. Enjoy it. Take photos if you want to remember how your skin looks at its natural best. But then, in the week or two before your period begins, progesterone increases and estrogen drops. Progesterone stimulates your skin's oil glands. You might notice your skin becoming oilier, your pores looking larger, and breakouts beginning to appear, especially around your chin and jawline. This is premenstrual acne, and it's incredibly common. Some people also experience increased skin sensitivity during this premenstrual phase. Products that usually feel fine might suddenly sting or irritate. Your skin might feel more reactive, more temperamental. This cyclical pattern is normal. Understanding it can help you adjust your skincare routine accordingly. In the weeks when your skin tends to be oilier and more breakout prone, you might use your acne treatments more consistently. Focus on thorough but gentle cleansing, and perhaps use lighter moisturizers. In the weeks when your skin is drier or more sensitive, you might emphasize hydration and barrier support. The key is working with your cycle, not fighting against it. Now let's talk about pregnancy, a time of dramatic hormonal changes. During pregnancy, estrogen and progesterone levels soar. The effects on skin vary widely from person to person. Some people experience the pregnancy glow. Improved circulation brings more blood flow to the skin, creating a radiant, flushed appearance. Increased estrogen can improve skin texture and reduce acne. Others experience the opposite. Acne worsening, increased pigmentation called melasma, or the mask of pregnancy, stretch marks, increased skin sensitivity, or changes in skin texture. If you're pregnant and experiencing unwanted skin changes, know that this is temporary. Your body is focused on growing a human being. Your skin responding to that massive hormonal shift is completely understandable. After delivery, as your hormones gradually return to baseline, your skin will likely stabilize too, though it may take several months. Be especially gentle with your skin during pregnancy. Avoid harsh treatments. Be cautious with active ingredients and consult with your doctor about which skincare ingredients are safe to use. This isn't the time to experiment with aggressive treatments. Simple, gentle, consistent care is your best approach. The postpartum period brings another dramatic hormonal shift. After delivery, estrogen and progesterone levels drop sharply. For some people, this triggers noticeable hair shedding a few months postpartum. It can also affect your skin. Dryness, increased breakouts, or changes in skin texture are common. Additionally, the stress of caring for a newborn, sleep deprivation, and the physical demands of breastfeeding, if you choose to do so, all impact your skin. Be extraordinarily patient with yourself during this time. Your body has just accomplished something remarkable. Your skin will adjust, but it needs time. Keep your routine simple. Focus on the basics: gentle cleansing, moisturizing, and sun protection. That's enough. If you're too tired to do even that some nights, that's okay too. You're doing your best, and that's what matters. Now let's discuss perimenopause and menopause, times when estrogen levels gradually decline and eventually become very low. Estrogen has been supporting your skin for decades. It maintains collagen production, supports skin thickness, promotes oil production at healthy levels, and helps your skin retain moisture. As estrogen declines, you might notice your skin becoming drier. The oil glands produce less sebum, which means your skin's natural moisturizing mechanism is less active. You might need richer moisturizers than you've used before. Increased sensitivity. Skin can become more reactive during hormonal transitions. Products you've used for years might suddenly cause irritation, changes in texture. Declining collagen production can lead to thinner skin, more visible wrinkles, and loss of firmness. Increased redness or rosacea. Hormonal changes can trigger or worsen rosacea symptoms. Changes in wound healing. You might notice that cuts, scrapes, or blemishes take longer to heal than they used to. These changes can feel unsettling, especially if you've enjoyed relatively stable skin for years. But understanding that hormones are driving these changes, not something you're doing wrong, can help you respond with appropriate adjustments rather than frustration. During perimenopause and menopause, your skin needs extra support. Consider richer moisturizers to compensate for decreased oil production, products with ingredients like retinol, peptides, or niacinamide that support collagen production, gentle exfoliation to help with texture changes, extra sun protection, as hormonal changes can increase pigmentation concerns, professional treatments if desired, such as prescription retinoids or procedures that stimulate collagen. But also, please hear this. Aging is not a problem to be solved. Hormonal changes are natural life transitions. While it's perfectly fine to want to support your skin through these changes, you don't need to fight against the natural process of getting older. Your worth isn't tied to having the skin of a 20-year-old. Your skin at every age can be healthy, comfortable, and beautiful in its own way. Beyond these major hormonal changes, stress hormones like cortisol also affect your skin. When you're chronically stressed, elevated cortisol can trigger inflammation, worsen acne, accelerate aging, and compromise your skin barrier. This is yet another reminder that skincare isn't just about products. Managing stress, getting adequate sleep, and taking care of your overall well-being all contribute to skin health. Some medical